Hey you guys, let's do a quick overview of the discomforts during pregnancy. So remember, the reason why we have nausea and vomiting is a rise in estrogen and really progesterone. So eat dry crackers, avoid odors, and small frequent dry meals. Heartburn and gastroesophageal reflux disease, it's because of a rise in progesterone. The whole gut is relaxed and the stomach presses up. It's getting pressed up because the uterus is pushing upward onto the stomach. Again, small meals, low sodium antacid Tums, avoid overeating and fried foods. Skin changes, darkening, there's really no intervention. And then striae gravidarum, avoid rapid weight gain. So you guys, stretch marks are genetic. So if your parents get them, usually you get them, or if they don't get them, you usually don't get them. We can tell them to use lotions on their skin, which is the epidermis, but the actual stretch marks are a little bit below that, in the dermal layer. Keeping the skin nice and hydrated, is nice. Don't gain weight too rapidly. That's really the bottom line. If they gain weight fast, their skin's going to stretch too fast, the dermal layer, and it's going to break. Urinary frequency, they have to void a lot. So in the first trimester, it's normal because of the hormones. Second and third, it's because the big uterus is pressing on the bladder. Tell them to void frequently, decrease fluids in the evening, and make sure that you educate them on UTI prevention. Remember, we said that a lot of people don't feel UTIs during pregnancy, but a lot of people do. So if they feel burning, make sure you tell them to come to the office. Fatigue, yes, hormone changes, weight changes, rest and nap, seek assistance. Breast tenderness, remember it's the hormones, progesterone, HPL, estrogen, human placental lactogen, and then the breasts are getting bigger in size. Wear a well-fitting support bra. Leukorrhea, remember that's the white discharge that is increased during pregnancy due to the rise of estrogen. So keep it nice and dry. Don't douche. Don't try to get it out. They'll just change the flora of the vagina and it can cause a yeast infection. Nasal stuffiness and nosebleeds is a rise in estrogen. Remember, the whole head, it swells, the throat swells, the nose swells, they start snoring. So a cool air vaporizer can help. They can't use like Afrin nasal sprays because it's a vasoconstrictor and we don't want anything getting to the placenta. They can use sea sprays, which is normal saline. Tylism, which is excessive spit during pregnancy. Their saliva is so thick they can't swallow it. So we tell them to drink a lot of water, a lot of water, so it thins it out. They can use astringent mouthwashes, chew on gum, or suck on hard candy. Dependent edema is totally normal in the legs and feet. You guys remember to hold that extra volume. Their blood vessels dilate, and when they're maxed out on their dilation, the plasma leaks out of the blood vessel and into the third space, which causes dependent edema. So elevate the foot and legs, try to get it back to the heart, that fluid, and don't let it sit. It's due to gravity in the legs, excuse me. And then foot exercises, just do the ABCs with their feet. Varicose veins, remember the compensatory mechanism for the increased amount of volume of blood is vasodilation. So if they already have a broken valve, a leaflet valve that helps their blood to flow one way, when it's under higher pressure, it's going to fail more. And if you have one that's about to fail, of course it's going to fail. So people see a lot more varicose veins during pregnancy. Elevate their legs just to take the pressure from gravity off of their legs. Wear support stockings. Avoid standing for prolonged periods and avoid crossing legs. Crossing legs puts more pressure on those vessels. Constipation, of course, we know it's from progesterone. Also, it's from taking prenatal vitamins with iron. We know that iron makes you constipated. And so even though we tell them, you got to take this prenatal vitamin, take it on an empty stomach, take it with orange juice to get the most iron, it still is going to cause them constipation. And then, of course, the uterus is pressing on the colon and the ileum, and it is slowing everything down. So it's a lot of constipation. So increase fluids, fiber, exercise, all of those things increase your ability to have a bowel movement. And then, of course, regular bowel movements. Hemorrhoids, we don't like those, but all those are varicosities, just like these little leaflet valves of the rectum. And so we don't want them to push when they're having a bowel movement, because it puts more pressure on them and can cause them to have a very much pain there. Avoid constipation. They can use ice packs, topical ointments, and Tux pads. There's also warm soaks and sitz baths. And then backache, we know they can have backaches from just the relaxing their hips and their spine. And so the gravid uterus, or the pregnant uterus, pulls forward and puts more pressure on the back, resulting in lordosis of pregnancy. Proper body mechanics are really important. You don't want them to have a pelvic tilt forward. You want them to maintain in a straight line, and then comfortable low-heeled shoes. Abdominal pain, round ligament pain. So as the uterus grows, the ligaments that hold the uterus in place are going to stretch, because relaxin is there, allowing the uterus to stretch upward as the baby grows. So it hurts sometimes. Those ligaments hurt as they're stretching. So avoid overstretching, like side stretches, like when you put your arm over your head and your hand on your hip and you're stretching to the side. All you're doing is making that worse. So tell them not to do that. If they do have to stretch their body, you tell them to raise their knee, and it will shorten the distance and make it not hurt so much. And then they can put heat. They can have a warm bath. Leg cramps due to changes in magnesium and potassium. And it's usually in the back of their calf. So what you want to do is have them dorsiflex to stretch. So it's usually in the calf. You tell them to take their toes and pull it to their nose to stretch out their calf. And then heat can help. Faintness, so you guys, that big old gigantic uterus presses on the blood vessels and the inferior vena cava. So when they get up fast, they get orthostatic hypotension. And so we don't want that. So you got to tell them never lay flat on their back, never ever, because it decreases the amount of blood flow to the placenta, and the baby can get deoxygenated, so can mom. And then avoid sudden changes in position. Avoid prolonged standing. Educate mom to never lie flat on her back in the second and third trimesters. And then dyspnea, difficulty breathing. The uterus presses on the diaphragm and lungs, resulting in difficulty taking deep breaths. But you guys, they should never have respiratory distress. If they ever have chest pain or difficulty breathing, just in general, not taking deep breaths, because the uterus is going to block it, but they should be able to breathe fine, and they should never have chest pain. If they did, you would tell them to go to the ER if they had chest pain or difficulty breathing, can't breathe. Evaluate for severity, posture, tell them to try to stand up straight and have pillows for sleeping. Thank you so much.